about that? You mentioned the festivals that they were having and.
Well, I was talking about Holi. It's an Indian festival of colors that takes place during spring, which is coming up in March. And one of the highlights of the Holi was not the kids, but the adults. It was the drink. It's like a shake they make out of marijuana leaves. They just grind the leaves and toss it in some milk and just drink it straight up. So, and it was obviously they get a little high, but conscious and aware enough, that they're dancing and having good time. And next day they all go back to their regular basic lives.
So
it wasn't
that.
addictive or
Right.
anything. And women who would not drink straight up, they would actually make fritters out of gram flour and marijuana leaves and just fry them and eat them, and it was okay. It is still legal in India, and they do it. So I don't think it's addictive. But at the same time, given the labor class in India, I don't know what the stand of India is nowadays because I left the country about 20 years ago. But when I was growing up, the labor class, which don't have access to expensive medicines for headaches and backaches and body aches after a whole day's work, because working in the fields and the garden and domestic help, starting 4 a.m. to 6, 7 p.m. and it goes, especially with the live-in help, it goes all around the clock. This used to be their timeout in the evening, about 6:30, 7 p.m. They would take a few leaves, dry it in the sun. They just crush them, put them in little, we call them chilmans. I don't know what they call them, little smoking, pipes, and with a little bit of water and all, and they smoke it. And this will take care of the relief of their body aches, the stresses, like doctor was saying about their mood receptors. It will make them happy. They would talk about little stories from their villages and their, their daily lives. Take a little break and they smoke around. And we were, as kids, playing around it. We never got secondhand smoke high or anything.
She talked about using marijuana for pain.
Right.
So can you contrast marijuana for pain versus medical prescriptions for pain?
Yeah, she made very excellent revelations and points with the use of marijuana for pain. I had earlier commented that they have the cannabinoid receptors for pain in the brain, and this is where the cannabis works on. And so basically, when you take marijuana, it helps you with your chronic pain, neuropathic pain, which is so painful. And when these patients use marijuana, it relieves the pain, as opposed to our prescription drugs, such as Percocet, hydrocodone. They don't get the relief with those prescription drugs, and they're considered less dangerous than marijuana, and so they tend to overdose on them. And those drugs cause a lot of accidental deaths. At least 19 people die from accidental overdose from prescription drugs, narcotic drugs, in the United States. That's a horrifying statistics.
Yeah, and I always like to use the analogy when it comes to pain medication of you're driving in your car and your gas light comes on, and instead of filling your car up with gas, you cut the cable and you don't see the light anymore. But that doesn't mean that your gas is back. So that's a good analogy that I like to use when it comes to the pain medication, because that's all it's doing. It's cutting off the nerve receptors, and you don't feel pain, but the problem is still there.
Right. Very, very true. And like she also said that with the use of marijuana, these patients don't have any addiction. And studies have actually shown that the addiction rate for marijuana is about 9% compared to alcohol. If you see an alcoholic suffering from alcohol withdrawal seizures, it is so scary. And there are lots of deaths from alcohol overdose, tobacco, 30% addiction, cancer, lung cancer, cocaine, about 20% abuse potential for cocaine, heroin, 25%. And so these drugs are more dangerous than marijuana. And marijuana has beneficial use and less dangerous than these drugs.
So there you have it, ladies and gentlemen. It sounds like the majority of our guests and our studio audience agree that marijuana should be legalized because of the medicinal side effects. So since we know that marijuana is not legal in Georgia and all the medicinal properties that they talked about, we can't benefit from them until our legislation change. So outside of marijuana, can you summarize, give us a 1-minute answer of what else can we do to get well and stay well?
First, my first answer would be I would continue to push and advocate for legalizing marijuana in the state of Georgia. So that's the first step we should do. We should continue to push for it, and some statistics show that more than 60% of Georgians voted yes to legalizing marijuana in the state of Georgia.
So what else can we do other than?
Right. We can continue. For our pain patients, we'll just have to stick with the regulations that we have now, continue to give them the pain medicine, continue to try to alleviate their pain, have them live a healthy lifestyle with diet and exercise. Regular exercise helps in anything that you do. So have the patients at least exercise 30 minutes to 50 minutes a day, 5 days a week, and then have them eat regularly, cut back on their salt intake, eat less greasy foods, and take their medicines as prescribed by the doctors, and try not to overdose on those narcotic prescription medications.
Okay, Dr. Okoba, you have just been outstanding with your knowledge in the area of marijuana. Thank you so much for joining us, and we have to have you back.
Thank you so much. It was such an entertaining audience. Thank you. I do appreciate having you all here.
And thank you to our lovely audience today. Thank you so much. So this concludes our marijuana segment, Step by Step. We'll be right back after the break.
When you're out there, there's no telling what you'll find.
I see it, I see it! Oh, look at you.
There are some moments only the forest can inspire. Find yours at discovertheforest.org.
So who's going to do what?
I'll pack the dead batteries.
Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice. And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
We couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Search Ready Kids at nyc.gov or call 311.